towards and away. Do you see what's happening? Look at the nerve. Towards and away.
Hey everybody, this is Dr. Perry from Stop Chasing Pain. Thank you so much for tuning into the video today. We're going to cover the trigeminal nerve. These things can be helpful for you if you suffer from pain or discomfort in the head, neck, face, jaw, headaches, shoulders. I'm going to be honest with you, if you're feeling pain anywhere, try to give this one a go. I think you're really going to enjoy it. So let's move right on into it. Let's start with why in the world do you want to even take a look at the trigeminal nerve? Okay. Well, let's talk symptoms first. One of the biggest things that people can get are what's called trigeminal neuralgia. That's a very painful, debilitating condition where you get inflammation in the trigeminal nerve. It can be on one side or both. Okay. These may be helpful for you, but I'm going to tell you right now that if you have a hot trigeminal nerve that's really lit up, it's difficult to do anything to it when it's that hot. So we highly recommend that you do the work to the non-painful side first. So if your left side is bothering you, start this work on the right, and you may find that it's carry over to get some improvement on the other side because they do talk to each other. Okay. If you don't have an active hot one really going on, then you can dive into both sides. If you have any type of face pain anywhere along the face, headaches are a big one with this nerve, pretty much anywhere, honestly. If you've had recent dental work done anywhere in the mouth, the trigeminal nerve needs some work. Okay, why? Because when the dentist sticks a needle in there, so it numbs everything, you don't feel the work being done. Well, that's the branches of the trigeminal nerve. Okay, so I can tell you already, if you stick a needle in that sucker, yeah, you're going to impact that nerve. All right. So pay attention to dental work. TMJ issues of all different types. Stress is a big one. The trigeminal nerve is intricately tied, which you'll see in a moment, to sensation on the face and the muscles of chewing. So those are highly linked to the sympathetic nervous system, fight or flight system, and survival system mechanism of the body. So you may notice a reduction in stress when you do these quite a bit. Poor sleep as well. You always want to work with the muscles of the face and the jaw when you have poor sleep because they can make a difference on your airway when you're breathing at night. And you can just work it honestly, even if you don't think you have any issues in there. First of all, you probably do. You just don't know it yet. That you can stay what we call a hashtag beast mode monster, where you can just keep that nerve strong and resilient. So let's talk about the trigeminal nerve. First of all, it's important to know that it's one of the most important nerves in the body because it comes directly off of your brain stem that sits in the back of the brain here. You've got different sections of it. So don't get intimidated by all these words. I just want you to see this uh, section here in the middle called your pons. Okay. You got your pons section here, and that's got different cranial nerves. These are nerves that come directly off of, it's called cranial because it's in your skull, but these are your survival nerves that I tell people. That's responsible for your ability to see, to hear, to taste, move your tongue, all these sorts of things. Are amazingly powerful for the brain. Anytime that you do work around the head, neck, or face, you make ginormous changes throughout the entire physical body, all the way down to your pinky toe. All right. So the trigeminal nerve you see here is cranial nerve number 5. Now you have 12 cranial nerves overall, but in actuality you have 24 because you have 12 on your right, you have 12 on your left, and they function in pairs. So the trigeminal nerve is number 5. It sits right there, and I want you to look at the size of that. It's a large nerve, huge nerve. Plays a big role in the body. So let's go over the main things that it does. It's going to be tied to sensation of the face, feeling things in the face, all right? And even inside that mouth as well. But you have different branches that you're going to see on the video coming up called V1, V2, V3. And these are the branches. Ophthalmic is just a fancy word here for around the eye. Then maxillary, you can see here, is around that nose and kind of jawline region, face region here, cheekbone. And then mandibular just means jaw. And these circles represent holes in your face where these nerves come out from where the trigeminal nerve sits deep inside of that skull. But remember, it ultimately starts in the back here at the brainstem. So sensation to the face, your ability to feel things in the face. And it also does the muscles of mastication. Okay. The muscles of mastication are the ones that I'm going to show you here. I'm going to make my screen a little bit bigger. It's the temporalis right here. So if you clench your jaw, you'll feel this muscle get tight. Another one is the masseter, this big bite muscle right in here. Okay, the masseter. And it's also going to be linked to your pterygoids. These are going to sit deep inside of the jaw to allow you to kind of shift your jaw from side to side. So when you see we do the glides later with the jaw, you'll be working your pterygoids. And when you do that, okay. And so you can see that bite, chew, the pterygoids come into play. And those are tied to stress, right? Because what do people do a lot when they're under stress? They clench their teeth or they grind at night when they're under subconscious stress at night. When they wake up in the morning and then they're all tired inside the jaw. So that's another way that these muscles relate to that fight or flight sympathetic dominant nervous system that a lot of people are with. Right. So you'll work those as well. And this is just another representation of those holes in the face here, the trigeminal nerve that you'll see. And I want you to notice that they're virtually in a straight line from each other, like that. Okay. But look at this bottom right picture here. Look at the branches of the V1, V2, V3. Okay. IC is the internal carotid artery. That's why you got to make sure you got good blood flow going into your head. All right. And these are the afferent pathways, sensory root of the trigeminal nerve. What is that? Afferent means, ascending, going in. What's sensory? Sensation. And it's going to go to that trigeminal nucleus. But look, it speaks with the vagal nucleus. Okay. Vagal nucleus. What is a vagus nerve control? That's cranial nerve number 10. And that's going to be the most powerful parasympathetic nerve in your body that's going to be tied to what? Relaxation, recovery, regeneration, and controlling the inflammatory reflex. That's why whenever you get face massages here, it relaxes you so much. All right. Now, notes. You should have no pain when performing this movement. Okay. But I'm going to put a little star next to that. You might have some temporary pain or discomfort when you begin to do the movements, but I want that pain or discomfort to slowly begin to improve when you're doing the movement. If it's not improving when you're doing the movement, you need to alter your movement, which means maybe you need to slightly change your position a little bit. You might be too far into it. You might be going too fast when you're doing these things. And if those subtle things don't change it, that means you're not ready for this yet. I need you to stop, back off. Don't do that one right now. And then try the opposite side and work with the opposite side for a little bit and see if it calms down. So you're going to need to play around with how far you go and your tempo called, your speed, things like that. The dose is the poison. What does that mean? That means even good things can take you out if you take too much of it, right? More isn't better, better is better. So this is where I struggle a bit because people always ask me, well, how many repetitions should I do? How often should I do it? How many days should I do it? And the word that I give depends. Right. I know that's frustrating, but it has to be that way. It's based on the individual. The most important thing about this work right now is that you're exposed to looking at this. You're going to need to play around with it. I will tell you that when you work with nerves up in the head, neck, and face, it doesn't take a lot. So I would kind of start with maybe 3 to 5 repetitions on each one and see how you feel. Go by how you feel. Go about how you feel. Pay attention to your body. Don't overthink it. Trust it. Don't stop breathing. One of the things that's going to happen to every single one of you, and you're not even going to realize it, is that you're going to stop breathing when you do this movement, usually because you're trying to concentrate so much on following along with me and finding it that you're going to forget about breathing. But a lot of times you'll hold your breath when you're under stress and duress. So people that have trigeminal nerve issues, irritation in the face, their reflex is to hold the breath. So make sure that you can breathe at all times in every position that you're in. If you're not able to breathe when you're in that position, you're in the wrong position. All right. Like I said before, do 5 to 10 glides, see how you feel. Hold the tensioners and the relaxation ones. You'll know what that means when you watch the video for about 10 seconds. All right. When you use the vibration ball or the vibration tool or massage around the V1, V2, V3 points, try about 10 seconds per point, somewhere in that ballpark. Okay. So the most important thing is the awareness of the spots that we're going to show you how to find them on yourselves next, and some of the things that you can do to calm them down. And then we're going to begin to introduce you to the head motions on how you'll put tension or stretch on a nerve, how you can relax a nerve, take pressure off the nerve, and then how you can kind of glide and slide the nerve to get motion and movement in it to ease up some discomfort or pain. All right, let's go.
Okay, let's take a closer look at where these are located on a skull. This is a fake plastic skull with different colors on it. I'm going to show you here and then how to find it on your own face. This face forward view here. The easiest one to find is V2. It sits right here next to the nose, right there. And the easiest way to find that is if you find your nostril here and you feel off near that cheekbone, you dig and massage there, you'll feel a little hole right in your face. That's the exact spot that you want to be on. And note, is one side more tender, puffy, or swollen than the other? That's important to know because in that region there's also some lymph that can be congested and blood flow gets stagnated here and you irritate that trigeminal nerve right there. Big time sensitive when you have sinus issues. All right, now we go down to the chin. The chin, you see this little hole right there? All right, that's V3. These are more challenging to find, but trust me, they're there. You're going to have to play around with that one. And the easiest way to envision it is a line drawn on your face. So if I find V2 and I draw a line down, I'm going to hit V3. You see that? So if this is V2 and I draw a line down like that, it's usually going to be kind of roughly in line with the outside of the lip. It's right there. I just want you to know it's not here and it's not out there. Right there is it. Okay? And then check the other side. That's really going to be tender if you've had any dental work down in here, or maybe you have periodontal disease or gum disease or anything like that, or if you have some inflammation backed up in the submental, submandibular, below the jaw and chin lymph nodes. Then you've got above the eye. This is a little tougher to see. I'm going to zoom in there. See that hole there right there? Just like that. Here, and then there. So once again, if I start here on the cheek and I do a line up, you'll find that they're usually going to go pretty much in a straight line with each other. And just to make sure that you don't miss the one up top here, I usually take 2 fingers and I'll put it there, and then you're going to find it. That's a sensitive nerve spot, by the way. That's how you find the locations. Now, once you find them, what do you do about it? Well, the most important thing is knowing that they're there 2, knowing that you should work them. 3, doing different things to them. It's just this simple. I'll show you a couple of things. Take your fingers and simply massage them in circles, all different ways. I like to do 2 at a time, and then taps. Lightly tap, I don't know, 5 to 10 times, something like that. Make up a number, whatever you want, and you can go back to rubbing. Then go to 2. Now, I also don't care what order you do these in. You can do here, you can do here, you can do here, you can do here. It's whatever you want. Just do all 3 at the same session. Rub there and tap. Don't forget to breathe, preferably in and out through your nose, keeping your mouth closed. Good for the diaphragm motion. Right. And then up here on the eye, I'm going to use 2 fingers just to get that. Oh, that feels really good. And then tap and rub again a little bit. It also feels nice to kind of grab the skin in these areas a little bit and lift up on the skin. Create a little space right where the holes are so then stuff can drain. That's also an option. This feels glorious right above the eye like that. Oh, man. That's a new favorite right there. And probably my absolute favorite is I use vibration. So this is our Mojo vibration ball that we use. If you want to get that, you can go to the description of the video and then click on for our shop, or you just go to Amazon and get one there. Okay. So you turn on the ball. There we go. And it's going to vibrate. And if I zoom in close, you'll see my finger shake. So I'm going to hold the ball, take my finger off, and my finger shakes. See that? I'm going to put the finger right on that spot and let it vibrate. So the ball and the finger does the work. It vibrates if you want to rub at the same time. That feels really, really good. Oh, wow, yeah. This will get your sinuses flowing like crazy when you do it around your cheek. And then up and through here, this will get those frontal sinuses. And maybe you got some sinus congestion or a headache right there. Now, I like to use the finger. You can take the ball and put it on there directly. Just don't put a ton of pressure into it because it'll vibrate too fast and you'll usually get a headache. So it has to be light pressure. It's just whatever you're comfortable with, okay? Play around with it, but it shouldn't cause you any discomfort or pain. So that's the first part where we're going to release the tension and tightness around the V1, V2, V3. Create some space up underneath there to help the blood flow, the lymph flow, and the nerve. And then now we'll show you some ways that you can, one, put tension on the nerve, called nerve tensioners. You can relax the nerve, and then you can do what's called a slide and a glide in between. All right. So this one's going to be fun on this next part, but it'll be a little challenging to get through this one when you first start because these are new movements. They're going to look kind of silly when you do it. There's no way you can't when you start moving your jaw around. But I'm going to use this cord here. It's just an elastic tubing that we use for therapy, and it's yellow because it's going to represent a nerve. Now, hang on. Remember, the trigeminal nerve is cranial nerve number 5. You have one on the left, left trigeminal, right trigeminal. They always talk to each other. Right? And so if you have trigeminal neuralgia, for instance, that's nerve's going to be pretty hot. So you'll want to start to do this work on the non-painful side. Okay, the non-painful side first. Even in relationship to those massages, you might not be able to tolerate that when the nerve is lit up. Okay, I'm going to show you how we'll do the left one, and then we'll show you how you do the right one so you can follow through with each one of them. Now, nerves can be lengthened. Okay, that's called a tensioner. where we're going to stretch both ends of the nerve. So if I know that the nerve is going to end here in the face, that's one spot, and I know the nerve starts in the back at the brain stem, remember, on that pons, left side of the pons, right side of the pons here. So this is the basic kind of course of that nerve. You just can't see it because it's inside your head, but this is the course of it. And it's going to go through all those different branches. All right. So I just want you to kind of get a feel for this nerve. So when we do tensioners, we're going to put our head in positions that actually lengthen this out. Okay. So that helps you kind of understand why I'm going to be bending my head certain ways. When you do things that are relax the nerve, we actually take the two ends close to each other. You see that? So now it relaxes. And if I have it here and here, then that's going to make a difference on where I turn and move my head to put tension on this nerve. You got me? Okay. And then the slider and the glider is where we're going to put the nerve on tension. And then I'll show you how you do it from the jaw, and I'll show you how you do it from the back at the brainstem part near the skull, where you just kind of move it so it flosses a little bit like this. It gets a little bit more like this, like one end kind of goes like that, one end goes like this. So I'm getting some motion in that nerve. Does that make sense? All right. Easiest one to figure out are the tensioners, but put a star next to this. When a nerve is really hot, you might not be able to tolerate a tensioner. So you might have to first do the relaxation one. All right. It's going to be different for everybody. But I'm going to show you the tensioner first so you can understand why you're moving your head and things this way. If the nerve starts in the back at the brain stem, at the pons, and it's going to come towards the face, okay, what I want to do is I want to actually pull my chin back like this and open up the space behind my skull and my neck. And that's going to put a little tension on this. Can you see that? Like if this is the point here, watch. And if I pull back, you see how that gets a little stretch in it. So I'm automatically putting a little bit of stretch on this when I pull my head back like this. Then I'm going to open up that space even more. And what I'm going to do is I'm going to just pull back, tilt my chin forward a little bit, and that's going to open this area up and put even more tension on it. Okay. Now, if this is the left trigeminal and I want to put stretch on it, I'm not going to bend to the same side, because when I bend to the same side, I'm going to relax it. I'm actually going to bend my head away from it. Can you see that? So it's going to stretch this side. So the second part is where you're going to turn your head this way, like laterally flex opposite, it's called side bend. Pull your chin back, flex forward just a little bit at the top, side bend away. And then now what you're going to end up doing is let's look at rotation. If I rotate towards that side, this gets slack. If I rotate away, it gets what? More tension. So the next part is where I'm going to have the side bend, and then I'm going to rotate away. Got me? Now we're going to use the jaw. The jaw is going to go sideways away from the nerve side. Okay? Because if I move the jaw away, it's going to stretch that nerve. If I move the jaw towards, it's going to relax that nerve. Okay? So after you've bent sideways, after you've rotated away from that side, you're going to move your jaw away from this side. It's under a lot of tension here. Okay? Then the last part, after you've moved your jaw to the side, is you're going to flex your head further forward. like this. That's optimal tension right here on that nerve, okay? And then you're just going to hold that for like 10 seconds and see how it feels, and then you relax it. So let me walk through that whole sequence together. This is the nerve going to here. I'm going to pull my head back, retract my chin, tilt just up at the top. It's called the occipital region here. Right? Just like this. Bend my head away from the nerve side, turn away from the nerve side, move my jaw away from the nerve side, and flex my head forward more. Like that. That's optimal tension. Now, if you want to now move into the kind of glide flossing part, moving part, here's how you're going to do it. Let's get to that start position, right? Where we're going to go. Pull back, flex forward at the top, bend away, rotate away, move the jaw away, and come down. First one you're going to do is you're going to tension this end and relax this end. You're going to move the jaw towards and then away. Towards and away. Do you see what's happening? Look at the nerve. Towards and away. Towards and away. Towards and away. Okay? Now, the next one is where you're going to do the motion at the back of the head where the nerve starts. So I'm going to get in this position. Now I'm going to move my jaw to the side, but watch what I'm doing with my head. Okay. Here, I'm going to go like this. See how now it's happening now is the nerve is going to be really stretched here, then relaxed here. Stretch, relax, stretch, relax, stretch, relax, but the jaw is moved to the side. All right? And you should feel this tension along this pathway of that trigeminal nerve. Holy cow. I feel really freaking good on this left side. And my right side really needs it. And my right side really needs it. So let's go and do the other side together. And then we'll end with the relaxation one. So now we're going to do the right side trigeminal. I got to tell you, I mean, it's a huge difference on how much better this side feels than this side. I can't wait to get this one going. So right trigeminal at the brainstem coming forward to the base, right? So if we want to get this tension, remember step one, pull your chin back. Then lightly tilt that upper cervical forward. Bend your head away from the right. Rotate it away from the right. Look at that nerve stretching. Okay. Move your jaw to the left, away from the right, and then flex the head forward a little more. Hold that for the 10 seconds. Now let's slide and glide this end of the nerve. So keep that in position. Watch my jaw. To the left, to the right. Left, right. Left, right, left, right. Got it? Now, the jaw stays over to the left. Move the head up and down like this. We're going to floss this end. Don't forget to breathe. Just like that. Okay? Perfect. Now, I feel much better. Now that we've done that, how do we relax it? Well, we're going to reverse everything that we did there. Okay, we're going to reverse everything that we did there. So let's go back to the left-hand side. Okay, so now let's do the extension one. This is the relaxation one. All right, I'm going to do the right side first, and we'll do the left side. We're going to reverse everything that we did before. So it starts at the brainstem in the back. Remember, at the pons, comes forward. So the first time we did this to tension it, we went into what's called flexion. This time you're going to just go in the upper part of the head and extend that occiput like this. Okay, and that occiput. Bend the head now towards the right to the same side. Rotate to the right. Your jaw moves to the right. And then extend the head more. That's the position where this nerve now relaxes. Okay, so I'm going to do that again. Here. Extend, side bend right, rotate right, jaw goes right, extend the head more. And now this nerve is relaxing. And hold like that. Okay. You're not doing any flossing at that point. This is just relaxing. Now let's go to the left trigeminal. Here. Actually, this way. There we go. Okay. Extend up at the top, side bend to the left, rotate to the left, move your jaw to the left, extend your head more, and relax. Now, you understand why you're moving your jaw this way, right? Because if I move the jaw to the right, what happens to the nerve? It gets longer. Okay? Just like that. Now, when you do these in real life, you won't have this bundle around you, so it's going to look very different. Okay? Because this thing is just a visual for you. So now let me show you what it's like without that nerve. Okay? First one you're going to do is a tensioner for the left hand side. Pull the chin back, flex the upper cervical here forward. Okay? Bend your head. I'm doing the left one. Bend your head to the right. Rotate your head to the right. Move your jaw to the right and flex your spine forward. And you move how you need to get that optimal right there. Okay. And then how would you floss it? Get to that position. Here, here, side bend, rotate, jaw, flex. Now move the jaw back and forth. Keep the jaw here and then move the head. Got it? Then we do the same thing on the other side. Here we go. Right trigeminal. Pull back. Flex forward a little bit. Bend away. Rotate away. Jaw away. Flex forward. Hold. Now the jaw. Back. Huh. 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 Now the neck. Got it? Now, how do you do the relaxation one? It's just the opposite. Extend at the top, bend to the left, rotate to the left, move the jaw to the left, turn your head back. Hold. Now the right. Tilt the upper head back, bend to the right, rotate to the right, jaw to the right, head back. Come up, here, and good. All right. Well done. Thank you so much, everybody, for tuning in. I hope you enjoyed that video and you got a lot of value out of it. I think it's going to make you feel a lot better. Just go in easy, go in slow, trust yourself, be in the moment, don't overthink it, feel first, think second. Please leave some comments below on what you experienced, and then also leave comments on any type of topics or videos that you would like to see us do. We really do look at the comments. They help us become better at making the videos because we really love to share this information, and we hope that you enjoy watching it. And please, if you haven't done so already, please hit that subscription button so you never miss a future video coming on out. And you can even hit that post notification bell, and then you'll find out when we get a brand new video posted all the time. Dr. Perry from Stop Chasing Pain. Thank you so much. We'll see you on the next video.